find a urologist at University of Texas. And I mean, I'm looking at the reviews. This lady is the stuff. Okay. So I'm like, this is who I need to see. So I go in and see her. We do another cystoscopy. And she says, yeah, something's in there. I'm not sure it's cancer, but, you know, we're going to go in there and take a look. And if there's something there, we'll take it out. So I have that done. Week later, I call the office. No response. Leave a message for her nurse. No response. I'm scheduled to see her 3 weeks later. So the second week I call, nobody calls me back. I'm just trying to find out, you know, what the deal is. I still don't get a call back. So now it's time for me to go in for my visit. I go in for my visit and the physician's assistant comes in, and she comes in, she's got paperwork in her hand, and she says, okay, so the doctor wants to see you back in a couple of months. Everything's good. In the corner of my eye, I see the pathology report in her hand. And she's talking and waving it, but I'm looking at it. And I said, okay. I said, is that mine? And she said, oh, yeah. And I said, can I see it? I mean, interestingly enough, I mean, I'm not even thinking about it, but I just take it out of her hand. And I look on there, and the pathology report says cancer. At her, like, okay, this lady just came in, everything's fine. You need to see the doctor in a couple of months. And I said, are you gonna tell me about this? And she just kind of looked at me with this baffled look, but now I'm angry. I'm angry for so many reasons. I think that as Black women, we get discounted in the medical community when something's going on with us. Oh, it's just this. Oh, it's just that. And I know in my spirit, I know in my body that something's not right. The other thing I'm angry about is it's been 3 weeks. Okay. And when I looked at the pathology report, it about 3 days after the surgery, and nobody called me. So at that point, she can see and feel my anger, you know, and I'm thinking, lady, you ought to be glad I'm a child of God, because I would just jump up and take you there. Okay. I mean, it just, I'm thinking, did she not even look at the paperwork when she came in and told me, oh, you can see everything's good. You can see the doctor in a couple of months. So anyway, at that point, she looks out because she can feel the fury in me. And then the doctor comes back in. The surgeon, she comes back in and she apologizes. I'm so sorry. Here's what we're gonna do. I'm gonna refer you to one of my partners.
Okay, so wait. Because I didn't want to like take the fire out of the fury in this, but I just have to pause because I know that people are thinking, wait, what?
Yeah.
So
yeah,
you have this surgery. They take a specimen, they send it to the pathologist for a review.
Yes.
The pathologist evaluates it, sends it back. You don't hear anybody.
Nothing.
Like nobody calls you.
No.
You call, nobody calls you back, and this happens for a 3-week period. And on the 3rd week, you have an appointment scheduled as a follow-up.
Right.
Go in, the surgeon herself doesn't even come in to see you, but sends in an assistant that says, hey, come back in 2 months. Everything's good. Here's a lollipop and a balloon.
Exactly.
And we'll see you in 2 months.
Yes. And I am fighting mad. I really am. I mean, and you know me, you know, one of the things that we do is when we're that angry, we start crying. And she's thinking I'm crying about the pathology report. No, that's not why I'm crying. I said, so I don't need to be comforted. I need to know why your physician's assistant came in, told me everything was good, and this pathology report says something different. And she says, I'm so sorry. I'm so sorry. You know, I'll talk to her about it. So I'm going to refer you to my partner who's a cancer specialist. And at that point, I'm thinking, I gather up my paperwork and I just quietly walk past her out the door. I stop at the front to see if I owe anything. They say I don't. And she's like, oh, Ms. McCardell, we need to make your follow-up appointment. I just keep going out the door and get in my car. Because I'm thinking, okay, these people don't know that I'm homicidal right now. Okay. And that they need to get out of my way.
Yeah. Nobody, I don't think anybody would blame you for that, but I just gasp, right? I gasp because I know that this is happening to a vast percentage of people in healthcare now, because the healthcare model has changed so much that we have medical professionals. We have a niece right now who's in medical school, right? And I'm thinking to myself, in her mind, she's coming out to practice medicine and help people, right? But we have this corporate production model now where we don't even know our doctors anymore.
No.
I still remember knowing like my doctor's families, knowing when things were happening in their lives, you know, they knew my family. And now the production model says you have like 3 to 5 minutes to assess a patient, get in, get out. And if you don't meet those numbers, you can't pay your mortgage.
Yes, and that's the other sad part of this thing. That's the other piece that you know, there's the part with us, and then there's the part with them, because they can't really spend a whole lot of time with you. And unbelievable. When I think about it, and when I thought about it, I actually, when I sat in the car, I wasn't thinking about myself. I was thinking, if I was the kind of person who just took the word of what this physician's assistant told me and just say, oh, I'm good, you know, and, you know, 3 months later, I would be dead, you know? We'll see in a couple of months, you're good. But I knew even before I saw the pathology report that something wasn't right. And unbelievable. But that's part of that's part of our challenge. And part of the charge to me is letting people know that they have to be super diligent about health. You have to be. If you know something's not right, if you feel something's not right, you gotta get somebody's attention. If this doctor is not telling you what you need to know, you need to find something.
So I think that I want to pause right there, and because this is of course about the mental health aspect as well, right? So at this point, I think that we're aligned when we say that women have this very unique kind of inner intuition. Some people call it, those of us who are Christ followers call it the Holy Spirit, call him the Holy Spirit, right? And so we have this way of knowing intuitively that something is not right. However, we live in a world that tells us it's male dominated. So men are like, you're just being emotional, but go away. What's the point? Just get over it. You're gonna be fine. And so in your head, you're thinking, is this just premenstrual syndrome? Is this just menopause, hormone related stuff? Am I really losing my mind? Is my body turning on me? Like, you're asking all of these questions, and then it's impacting everything you do because it's like spirit, right? So it starts to take over. And so now you're at battle with your intuition, with the Holy Spirit who's saying this is what's going on, and all of these people are like, take a couple of aspirins in the morning, you'll be fine, right?
Yes.
So talk about that for you and your journey.
Yeah. Well, you know, the other thing is, if you buy into the madness with them, then you start to think something's wrong with you. Okay, what's wrong with me? Something's wrong with me. I remember going through this journey, and one of the gynecologists said, well, because of your age, you're probably gonna have some dryness, and that's what's causing the irritation. Yes, and that was another person I wanted to punch in the face, but I didn't. What are you talking about? But, you know, I praise God for discernment. That's the other part, you know, the discernment. Okay, so something is going on. Something is going on. You need to pay attention. You need to pay attention to it. These people don't know what they're talking. These people don't know what they're talking.
Right.
I had to learn how to forgive some people. You know, medical practitioners. I've had to learn how to forgive them so I could move on, you know, and take care of myself and do the things that I need to do. Because if I'm holding on to that stuff, that's not healthy for me either. You know.
So I got to ask you a question though, because you said something, and I want to be intentional about the way that I ask this question, as to not to exclude anyone, but to particularly bring awareness to those who do not know. Do you think that because there is such an implicit bias against ethnic minorities, and particularly Black women and men, that we should just see our own practitioners, our own specialists?
That's good. You know, I wish I could say that, just say that, because some of the folks who gave me misinformation were Black.
Yeah.
And, you know, I'm all about supporting our folks. So some of the folks who gave me the misinformation are Black. You know, it's unfortunate, but they're driven in the medical community by the same things that the other groups are. You know, you got 5 minutes, you got this, you got that, and you need to get out of there. So that's why it's so important for us to know what's going on with ourselves. And sometimes you have to make some demands, and I've had to in this journey, you know.
So look, I want to take something off the table though.
Okay.
So let me say this. So I want to share with people that not only are you a mother of 6 adult children who are exceptionally brilliant and successful, by the way, that you are not only a grandmother of 19 grandchildren, not only the great-grandmother of 2 children, but you are married and have been for several years now. You have the support of a husband, right?
Yes.
But you also are like this superhero. And I say this because I want people to kind of get it. Like I want them to, I need to paint the picture for them, right? So you would think that under the circumstances, you'd been given words that have been aimed towards you, like lupus, like, you know, bladder cancer, like rheumatoid arthritis. These are all debilitating things that take people out, like mild cases of it, right? But you not only continue to work professionally, you have several ministries, you are instrumental in managing a nonprofit, at least one, you sit on the board of several, right? And you have been a marathoner Like, she's run marathons, people. And then you have been a competitive tennis player, right? You have traveled. Like, she is a crafter. The running joke is knocking down walls, reupholstering furniture, like painting rooms, like all of the crazy stuff, right? And she cares for 2 aging parents. So I want you to just get that picture in your head, because there is also implicit bias that says that we're lazy,
Yes.
that we want to pull off of the government, that we are not taxpayers, or we don't pay property taxes, that we're uneducated or undereducated or underemployed or unemployed, particularly in this climate now. And I'm like, who are these people talking to? Because nobody I know is in that situation.
Oh, well, I totally agree. Well, and don't forget that we're drug addicts, okay? We're drug addicts too, okay?
So, which brings me to this. So, in pain management, and we know that there's a major opiate crisis, right?
Yes.
So with what I just rattled off for you, I think that the average person would say you would be justified in being an addict at this point. But literally, and I forgot one more thing too that I wanted to add to that list. But literally, that's something that you refute and refuse emphatically. Like, you are like, I will not put these contaminants in my body. But also I want to add too, that you are committed to not only eating right, but you're a vegan who has lost, I think, what, 60 pounds?
Yeah, about 55 pounds, yes. Yeah, so when I started this,
look, so all the stereotypes, everything that the world ever thought globally, like, shut that down. And by the way, when I look at the stats, there are more non-Hispanic whites who struggle with chronic pain in this nation than any other group of people. That's true. That's true. I just wanted to say that. Okay,
that's true. But when I got really clear that it was going to be me that needed to take care of myself, no doctor, you know, I decided to just change everything. So I am a little over 1.5 years into my vegan journey, and it's been awesome. I mean, and you know, like I said, I eat, I get down, you know, I eat. So I'm not interested in dieting, and I think that I look pretty good.
Amazing.
But I'm enjoying it. I am cooking all the time and finding all this stuff to do with plant-based living. I don't like to call it diet because I don't diet. It's made a huge difference in my energy level, my sleep patterns, and just my body overall. You know, so it's been pretty amazing. And yeah, I think my goal is to learn as much as I can about it so that I can share it with other people. It's been life-changing for me.
Chasing vegan food trucks, folks, too, is like an art form. Like,
I can tell you where they all are.
But I think, so I wanted to really just paint the picture, though, because there are so many, and I keep using this term implicit bias because I never really looked at it that way.
Yeah.
But I stumbled upon a press conference that came out of Michigan with the governor and all of these different officials. And one of the things that they are proposing in the state of Michigan is for medical doctors, when they go in to recertify, that they must complete an implicit bias survey.
Wow.
outcomes will determine whether or not they are fit to actually practice.
Wow.
Because what they're finding, and this was like one of those nerd moments, like the lights on, right?
Yeah.
Was that even when medical doctors enter into a room and they are gathering the information about the history and the physical of the patient, the medical history questions, there are a lot of them that they will skip over because of their implicit bias about the race or the gender or the ethnicity or the religion even of the person.
Yeah, and it's really sad. That's really sad. Yeah.
So imagine that. And I was like, this is a phenomenon. I'm not sure how far this will go, but I believe that this should be a requirement, definitely in this nation, but probably around the globe.
Yeah, I agree. I agree. Wow. It is, I've had during this whole challenge with bladder cancer, I have had at least 2 doctors tell me on 3 occasions that we just need to just take your bladder out. And I looked at him and I said, I'm sorry, I'm keeping my bladder. I'm keeping my bladder.
You know what? I want you to go deeper into that conversation though, because I really feel like people need to understand that they should go into every single conversation feeling empowered and not oppressed. So
Absolutely.
Can you talk about?
Yes, and let me tell you, when you have a chronic disease, when you get that kind of diagnosis, sometimes people just they just give in. Okay, so I'm gonna take the drugs, I'm gonna take the doctor's advice, and I'm thinking, there's no way. So before I don't know that I would ever make that decision, but before I would go to those extremes, I want to explore every single avenue, everything I could possibly do before I tell these folks, okay, take my bladder. There's no indication from God that I needed to have my bladder removed. I'm just being straight up, okay? Let's see, last year, because it's kind of, I'm still struggling with this thing. I go to MD Anderson. They're awesome over there. And I have 3 more surgeries. I'm still struggling with the pain. They put me on a treatment called BCG. And and the BCG treatment is as bad as the bladder cancer.
Right.
They put it in, they put it in a catheter and they put it into your bladder, and you have to hold it in for 2 hours and then you can leave the hospital. It's not a chemotherapy drug. Actually, it's a treatment for tuberculosis, but to be effective for bladder cancer. The crazy thing that happens when you get that treatment is you have to isolate yourself. So you can't sleep in the bed with your husband because you're contagious.
That was a big one.
Yeah, you could give your partner TB. Your urine is contagious. So every restroom that you use, you got to isolate yourself and only use one restroom. You got to spray it down with straight bleach. So it's crazy thing.
So you were COVID prepared, hygiene prepared long before COVID hit, right?
Absolutely. So I'm going through this whole thing, with my husband's support. It's just been amazing. And, I finally, I was at a point where I was tired of the whole thing, but I'm willing to do whatever it takes. But in my mind, my eating habits, my workout habits, my sleep, and even my prayer life changed tremendously. Because with everything that I was doing during that period, I'm moving in a different direction. So I'm like, I don't want any negative people around me. I don't want anybody feeling sorry for me. I don't buy into that.
No.
And I'm releasing a lot of things that I've been holding on to. Okay. Resentment. Some things that I needed to forgive other people for. Some things I need to forgive myself.
Well, I think at one point you shared that the reason why they did not suggest this treatment was because it was so painful. But you were like, I'm willing to do anything considering that 10 times the worst UTI I've ever experienced.
Exactly. Yeah.
Is happening.
And the other thing was, I'm not having my bladder removed.
Yeah, that's not going to happen. I'm not going to have all that. So as we progress, and you're talking about some very clear things in terms of mental health, one of the things that I want to be able to share with people is that everything that we think impacts our lives.
Yes. Yeah.
Everything that our mind processes impacts our lives. Everything that we watch, everything that we hear, everything that we see, it impacts our lives. There's a reason why we have all of these beautiful tools called senses, right? And we live in a world of information overload. Most of the information is toxic. The things we watch, the things we hear, the things that people say to us, right? So you're not watching anything negative, but you have people coming in saying things like, you're going to be okay. It's cancer, but we're not going to tell you. Or, you know, let's just take your bladder out. Or it's all in your head, you're fine. Just take this antibiotic, which, by the way, was killing all of the bad cells and all the good cells that could fight off anything else. So that just added to it, right? So here you are, and you're in this place. All the while that you're going through this, you're still doing all the things that I just ran down, with the exception, I think, of maybe playing tennis and running the marathon, but all the other things you're still responsible for, right? Yeah. And never telling anybody no matter what they needed, right? And this pain is so personal. This pain is so personal. And I love you. You know, I am counselor on call no matter what time of day or night. But even for me, there are times that I know that my responsibility is to remain in intercession, because this is a personal appointment with Father, Son, and Holy Spirit. And there's nothing that anyone could do, say, or even process enough to understand. And so I want you to talk about, like, for people to say, and they were well-meaning, but stupid things that just made no sense, right? And how, like, that made you feel at times. And
well, you know, I mean, one of the things that you said that is just so powerful is this person. It is personal. It's personal. And anybody who struggles with chronic pain, it's very personal. I mean, it's just, it doesn't matter how many adjectives I add to the pain. It's you when it's somebody else, it's very, very personal. And so people are well-meaning, you know, they're well-meaning. Oh, you shouldn't do this, you shouldn't do that. Have you tried milk? I mean, I'm just, you know, I'm being silly, but just, it's crazy. That for me, I just had to get completely quiet, because nothing else was working. You know, nothing else was working. I had to get completely quiet and work this thing out with God. Okay, what's my next step? What do I need to do? Need to do. And my husband, bless his heart, you know, I mean, just quite frankly, there were days where he was just in tears because he felt helpless, you know, he just felt helpless, you know, he wanted to take the pain away, you know, just amazing. The interesting thing about pain though is when it's gone, it's incredible. You know, when it's gone, it's incredible. You don't forget it, but you know, God is so gracious that I just know that I will never have that level of pain again, you know?
Yeah, I think when you talk about the pain being gone, and we've talked about this before, how when your body is experiencing such overwhelming, excruciating, endless, seemingly infinite, really pain, that your body starts to guard and brace itself.
Yeah, it's true.
And so now you have muscles that are tight in places they never were tight before. And so I think when you said the pain is gone, I think of how a lot of times we have a bad cold and we have that annoying, embarrassing cough that that it lingers and you're just like, can I just get rid of this? And then one day you wake up and you're not coughing, but it takes you a while to realize it.
Right.
I think that our bodies are like that in terms of pain too. What do you think?
Oh yeah, I agree. And then there was something that I just wanted to make sure that I mentioned about pain management, because I don't want people to think that during that process I didn't take anything for pain. Okay, because in the problem we have now because of our system and drug addiction, that people with chronic pain can't get the medication that they need. And, you know, we have a precious niece who is a pharmacist, a PharmD. So she's a doctor of pharmacy.
Right.
When I had my surgery, she was so angry when I told her what they had given me and that I couldn't get the pain medicine that they had prescribed for me. The reason I couldn't get the pain medicine that they prescribed for me was because I was Black.
Right.
And every pharmacy I went to, they looked at me, they looked at the prescription, and they said, oh no, we can't fill that, we can't fill that. Now, she was like, okay, I'm gonna call the pharmacy and let them know who I am, and they're gonna fill your prescription, Auntie. But, and so that's part of that implicit bias. Even with trying to get a prescription filled for chronic pain, for somebody with cancer, okay, they still look at you, okay. Yes.
You're a street pharmacist, you're an addict, like.
Right.
Did you steal this prescription from?
Right. Oh, yes.
And I'm thinking, this is insane for someone who is in chronic pain and just, you know how you're literally so hungry that, or let's take that. Let's do another scenario.
Don't do that.
At the front door, and you are jiggling the keys in the door because you really have to go to the bathroom. And you open the door, you slam it, the keys are still in the door, and you get to the bathroom door and somebody is in there or it's locked. You're just thinking, if I can just get to the pharmacy, get the prescription filled, put one pill in my mouth and swallow a little bit of water, that my life will improve dramatically. And you have somebody who is looking over the counter going, because you look the way that you do, you don't deserve to improve your quality.
No, that's right. That's
And
right.
I wanted to put a pin right there because there are going to be people who watch this that don't believe that this is real and that is true. And they're probably not going to believe that we have all of these amazingly brilliant people in our family, right? But to have, think about the people who don't have a family member.
Yes, yes. I mean, we have amazing support system because almost every area of our life, the need, we can say, oh, let me call. And it's just heartbreaking to me, for those folks who don't have that. I mean, it's so sad. But I ended up going to like 3 pharmacies and to try, and they go to the back and look at it, talk to other people, and then come back and say, oh no, we can't, we're not going to be able to fill that.
And let me tell you, I mean, so we've been in healthcare before your 3rd or 4th career, whatever one you're on now. As a clinician, as a clinical person, you remember we used to have something called a triplicate, right?
Yes. Yeah.
And the doctor would fill it out in their
Yes.
office, and there would be a copy that you give to the actual patient, a copy that went to the state, and then there would be a copy that remained, in the office and stuff, right? So we have had so much abuse.
Yes.
Of every possible kind of drug out here,
Yes.
that now each prescription has its own like social security number.
Yes. Yes.
So when you think about it, you have people who are making it impossible for people who really, really need the medication.
And it's so sad. It's so very sad. It is. It is.
Like, what can you give to the people who will see this and go, I've been struggling with chronic pain.
Yeah.
And I feel like nobody's hearing me. I feel like no one is able to even sympathize or understand what I'm saying. I feel like people are just telling me, you're just making it up. It's not real. I think about the people who have like fibromyalgia, which is very new on the scene.
Yes.
Right? What about the people with, MS?
Yes, because you look perfectly fine on the outside, but on the inside,
your body is turning on you.
Yes, that's exactly right. So I think that, it's a fight, it's a journey. You got to do the research, and you got to keep fighting until you find somebody who's willing to listen to you. I mean, sometimes I've been in meetings at MD Anderson with my medical team, and I'm the one standing up and being animated because I'm saying, no, we're not doing this. I'm not doing that. Yeah. Something's got to be done about this chronic pain thing. It's just not working. It's not working for folks. I'm blessed because, I just acted crazy and they had to listen to me. And that's in the flesh, in the spirit, I know that I had amazing grace, I had amazing grace. And I can't imagine, I'm sure that some doctors, based on the way I was acting, probably would say, okay, we need to get rid of this lady. But they were forced to listen to me because I said, no, this is not true. This is not true. This is what I want to do. If they weren't willing to do it, I was going to go somewhere else.
Yeah, I think one of the other things that was really alarming to me about doing the research about chronic pain in this nation is that they have recorded that there's a higher rate of people who have public health insurance who suffer from chronic pain.
Yes, yes.
Than anyone who has private insurance. And so when I read that, I just thought to myself, so, and this is not a political statement. I know there are people that'll watch this and think that this is a political statement, but we know that the implementation of the Affordable Care Act has served some people well. I know families that it served very well. I know a lot of young white families that it served very well, right?
Yes.
Not ethnic minorities. I mean, I know them personally, and they have said that it has literally rescued them and saved their lives, right?
Yeah.
But then on the other hand, when you hear that Medicaid and VA benefits, these are men and women who go and put their lives on the line for this nation, and they are treated like throwaways.
It's true.
So when they come back and they have pain because they lost a limb or they, endured a back injury or something like that, and they need medication, they are saying that, hey, yeah, we're not going to be able to do this. Or when you have public health insurance, they totally mistreat you.
Well, that's what happens.
Right.
That's what happens. And I'm not sure what they're doing behind the scenes, what the form says, but the bottom line is if you have public health insurance or no insurance, you don't get adequate treatment. You just don't. You just don't.
Yeah.
Wow. It's crazy. You do not, I mean, if you have a terminal illness, you just have a death sentence. If you're on public assistance, if you have public health insurance, if you go to the VA hospital, and that's no hit on the VA because they take care of a lot of patients, but the truth is, you don't get adequate health care. You do not. You do not.
Not unless you have an advocate with you that knows buttons to push to make people jump through hoops and things like that. And so I wanted to really just shed light on that because I think that there are a lot of people who have no clue that these types of things are happening. And my favorite line is, just because it's not your reality doesn't mean that it's not somebody's reality.
Right.
Yeah. So I think that the thing that I want to be able to drive in terms of the physical portion of it is be your own advocate.
Yes, absolutely. You have to.
Don't go buy a car unless you've done your due diligence on how this car works, what the maintenance schedule is on it, what the overall cost will be over time. It's the same thing when you go seeking healthcare instruction or navigation. That's number one. Number two is you must make different decisions about caring for yourself.
Yes.
And we always talk about proper diet, exercise, and there's some people who are struggling with making those decisions because they think that eating healthy is expensive.
Yeah, that's just not true. Not true.
And the other thing is that, and we know this particularly in ministry as clergy, that the majority of the people whose bedside we go to who have chronic disease or illness or terminal illness is that when we talk to them, and we just have an organic conversation, like we're not trying to go in and private eye investigators or anything. We were just like having a basic conversation. What almost always comes up is what you mentioned before, and that is resentment.
Yes.
You know, my favorite pairing of words is the root of bitterness has grown in their heart, and the stone of resentment has rolled, you know, over any tangible evidence of God or faith existing anywhere. And so the thing that I think we've just talked about, and one of the things that we shared was that we're going to start like recording our conversations because they can become pretty deep. But, you know, if we are closed to forgiving others, and if we are trying to guard our hearts from further disappointment, rejection, or abandonment, by closing ourselves off, we close our hearts to others, we close our hearts to God.
Absolutely.
We close our heart to Father, Son, and Holy Spirit.
Absolutely. Absolutely.
So I want you to share a little bit about your process and like where you are now as a result.
Yeah, so I am, I don't have bladder cancer anymore. That's a good thing. But I think that there are some things that had to happen with me for that to happen, you know. I don't, you know, the BCG treatment, that was good. But it just, it was like acid inside my bladder, you know? And so I'm quite a ways away from the BCG treatment. I think that I had to be willing, and I said it earlier, let go of some things, let go of some people, let go of some thinking. And one of the things that plagues us as women, and particularly minority women, is that we spend more time taking care of other people than we do ourselves.
Yeah.
And so I had to really focus in on taking care of myself, eating right, lots of prayer and meditation. And sometimes it's really hard to just get quiet and be by ourselves. I spent a lot of time doing that, and it worked for me. It worked for me. You know, you got to be willing to forgive. I think that we go through life holding on to so many resentments. It's just it just cuts your life short. You know, I always laughing, you know, I'm full of joy. Even during that process I was, because I wasn't willing to let that stuff just eat me up and take me out, you know. And, you know, I have regular conversations with God. Okay, God, I know you got some other stuff for me to do. So, yeah.
Yeah.
The key is, you know, you got to be an advocate for yourself. You got to spend some time with yourself. You got to spend some time with yourself. And sometimes it's hard because, you know, the emotional weight of trying to figure out what's really going on with yourself can be really heavy sometimes. But the joy on the other side is amazing. It's amazing.
Yeah, it truly is freedom. And, you know, there are many people who come to be, you know, clients, and we talk through a lot of things. And I think that one of the things that I'll frequently describe is that it's like freedom is on one side of the door frame,
Mm-hmm.
and the person is on the other side.
Mm-hmm. Mm-hmm.
And you're coaching them to just take the step.
Yeah.
And it is painful because there are days that the child is on the edge of the high dive, and we think this is the day that they're going to take the leap.
Yes.
And they don't.
Yeah.
And so I really just believe that even in your sharing, like, yeah, crossing the burning sands are uncomfortable. Like, yeah, they were irritating. Like, there were moments that I was inconsolable. But on the other side of that purging, of that pruning, there's something that purifying. There's something so amazing.
Yes.
Right.
Yes. And one of the things you mentioned was the marathons. I've done 6 marathons. So that's 26.2 miles on the ground. But I remember when I first started training for a marathon, I couldn't even run a mile. But the thing about a marathon is, it doesn't matter if you walk it, if you run it. I mean, at the end of it, you've done 26.2 miles. You're in the 10% of the world, okay? But life is very much that way, because the only way to do a marathon is to put one foot in front of the other, whether you walk it, you run it, you crawl it. And life is the same. You just have to make that next step. You really have to make that next step.
Yeah, I think that in Christianese leadership, we say things like, what's worse, you know, the devil you know or the devil you don't know? Like, most people are going to stick with the dysfunction, the, you know, pain, like, you know, all of those things and stuff that they could just surrender and walk into something brand new. But because it is uncharted territory, they're like, yeah, this is not quite right, but because I know how this is going to work out.
I'm going to stay over here. I'm going to stay with that. Yeah. And see, I wasn't willing to stay over there. That wasn't working for me. So I hope that anybody who views this gets is that what you can't do is give up. You can't just sit there and do nothing. Okay. You know, you got to get into action. You got to do the work. You got to ask the questions. And the biggest thing is you got to forgive yourself. Yeah.
And I think the other thing too that I'd like for you to kind of, you know, just briefly leave folks with is there are certain religions, which, by the way, God has no interest in religion. Christ didn't come to start a religion. I know that's an epiphany for some people. But there's some religions that believe and have taught that we are not to question God. We're not to ask him questions.
Oh, wow. If there was a camera and a microphone here, when I'm having my conversations with God about what, why, what, God, you know, no, that's not true. That's just not true.
Yeah, I think, you know, throughout scripture, you know, there are examples of people asking God, you know, hey, why? Not in a doubting way,
right?
But saying, you know, Lord, like, I just don't understand this, or these people just won't obey.
Right.
Hashtag real time trending. And like, we have all this different stuff that people are asking throughout scripture. And so, you know, I wanted to kind of bring that also to the table, because when we're going through challenging times and seasons in our lives, there might be some time that we will say, Lord, I just don't understand this, which is just a question rephrased as a statement.
Yes.
Yeah.
Absolutely. Yes.
Well, I want to just say that you are one of the most incredible people I know, and I don't say woman because one of the things that I know for sure is that even through our pain and suffering, because we love others so deeply and intentionally, that we will be so selfless that it's sinful.
Yeah.
And there are many people who see you as being superhuman and a superhero, not a hero, but being able to bear the burdens of the world, it seems, and take very little for yourself. And so God has not only sustained you, but He's blessed you in so many ways, and that makes me so grateful and so happy. Like, I just tear up thinking about it, because you know, there's always somebody who will say, I can't think of anyone more deserving than, in this case, the blank would be filled in with your name, because it's been so much that you've been through. I wasn't gonna do
I'm supposed to cry on here.
But we're just so grateful. We're just so grateful. And the thing that is so important too is to have people who are advocating for you in prayer and praise and deliverance and worship, on the floor crying out to the Lord and just thanking Him for all that He is to us. And so it has been an honor to be in that position and to watch God just do it. So my tears are tears of joy, but I'm also so privileged to be sitting here with you, seeing what God is doing through this platform, because you just shared in Mental Health Awareness Month and blessed so many people with your story.
Thank you.
With zero context, by the way, really. It was like a drive-by. I'm going to throw up all this stuff on all the people who are listening in 10 to 12 minutes or less. And, you know, people were like, oh, okay, so yeah, you had cancer, you're healed. And none of that really focused in on what truly you went through. And so I just want to thank you for opening up your hearts, being transparent and sharing, so that people will understand, you know, what this is like, and that there is hope.
There is hope.
Yeah. So I love you so much.
I love you.
And thank you for agreeing to share your story on the Process Preventive Mental Health Forum. And I'm sure we will see you again to talk about some other things that are
we have plenty to talk
better than this, right? We're super silly and crazy and talk about some interesting things. And so I just want to again say thank you, and thank you for joining us, to our audience, and share this, like and share this, subscribe, so that you know what's coming up next. But this is something that someone needs, and so we just ask you to share it with someone whom you love who could benefit from this. And then you can always email us, and our email address is theprocess.forum@gmail.com or andrea@theprocesspmhforum.com. So we look forward to hearing your feedback, and God bless you all. Bye-bye.
Bye.